Assemblymember Manshine. I believe you're next. Is that correct? Yes. Because I saw you come and go, come and go. So before you get started, Assemblymember, I'd like to take this opportunity to thank you. Yesterday, you were chairing when I was presenting SB 1010. It was a very long hearing. You're very kind and gracious. I know you didn't vote for the bill, but the fact that you chaired it and you were a gentleman, I thank you for it.
Thank you for those nice comments, Mr. Chairman. I appreciate that.
Thank you. Please proceed.
Thank you, Mr. Chair and Senators. I'd like to open by thanking you, Mr. Chairman, and your staff for working with my office to further improve AB 1051 with the suggested amendments, which I will be accepting today. Implementing the provisions of AB 1051 is critical in order to address the silent epidemic of tooth decay and disease in California by increasing the reimbursement rates for dentists. Denti-Cal provides dental coverage for more than 14 million Californians, including 5 million children, but has been chronically underfunded. Recent reports by the State Auditor and Little Hoover Commission found that less than 38% of Denti-Cal eligible children received dental care in 2014. Denti-Cal consistently falls short in caring for the 1/3 of our state's residents and half of our children that are covered by it. The system has been described as broken and dysfunctional. Not only are costs higher than average in California, but low reimbursement rates make it difficult for children to find a dentist to provide routine care. Reimbursement rates currently hover around 35% of the national average. Tooth decay and disease are also associated with pregnancy risks, diabetes, respiratory, and heart diseases. The inability to obtain proper dental care can have significant long-term impacts, which contribute to poverty. Our state health and social safety net programs should provide hope and opportunity for low-income Californians. Here to speak in favor of the bill is Brianna Pittman from CDA and Carol D'Elia from the Little Hoover Institute.
Good afternoon, Chair and members. Thank you. My name is Carol D'Elia. I am the Executive Director of the Little Hoover Commission. Our support of AB 1051 is based on our work Fixing Denti-Cal, our report that came out in April of 2016. As you know, I was here last week speaking in support of Assemblymember Wood's bill, which addressed many of the bureaucratic, burdensome red tape. The other piece of why many dentists don't take Denti-Cal is obviously because of the reimbursement rates. In fact, I think the dentists told us that's their biggest beef, that they receive a third of what they would receive from a commercial provider, and California is one of the worst as far as what we pay for reimbursements in the country. So what happens? Dentists choose not to participate. These 13 million Californians, 5 million children can't find a dentist to go to, so they don't go. Then their teeth hurt and they wind up going when they need expensive restorative work. So we now are funding 86% is all the expensive restorative work and only 14% the preventative efforts. So our commission, typically not in favor of across the board, just let's throw more money at the problem, was specific in that new money, if targeted toward preventative services, could go a long way. I know that there are some changes that were made, some amendments that were made as far as the case management piece, and I understand there's still a little bit of work to be done, but in general, the Commission is supportive of funding targeted preventative, adding higher reimbursements, as well as case management. We heard, I'll be very brief, in our hearing process, on Washington State, where they were the worst as far as children getting to the dentist, and then they became the first by putting funding targeting at preventative and case management. So with that, we continue to support AB 1051, and I urge your aye vote. Thank you.
Thank you. Please proceed.
Good afternoon, Chair and members. I'm Brianna Pittman with the California Dental Association, also here in support of AB 1051. As you've heard, there have been numerous reports over the last couple of years on the problems that the Denti-Cal program is facing. The 2014 audit found that more than half of the children in Medi-Cal did not receive dental care, and that there were many counties that did not have enough Denti-Cal providers, that had providers who were not taking new patients, or simply had no providers at all. The 2015 rate review that the Department of Healthcare Services did did found that since 2008, the enrollment has skyrocketed by 77% for adults, 40% for children, and at the same time, there's been a corresponding decrease of providers by 15%. They also found that our California reimbursement rates for common services are well below other comparable states and a fraction of commercial rates, so it's not hard to see that those two are connected. Again, this year, the Little Hoover Commission put out another report looking at the deficiencies. When we spoke to the Little Hoover Commission, CDA talked about the problems in Deni-Cal as a three-legged stool. The reimbursement rates are low, the provider network is inadequate, and there are administrative barriers that discourage participation. And coming out of all of these three reports, there's been substantial action that's being taken by this legislature, the Medi-Cal 2020 waiver, and at the department level, and we appreciate all the work that's gone into that. And we know that even, addressing these administrative burdens is not going to fix everything, and that part of the issue really is the money. And we do need to increase the provider rates. This will be essential for getting more dentists into the program and improving the access crisis that we're seeing. It's really it's an unsustainable rate structure that we have, and it means that dentists have to limit the number of Deni-Cal patients they can see or just stop seeing them altogether. When Deni-Cal patients are unable to access care, they delay, they have to drive far distances, and they end up in the emergency rooms. So we strongly are in support of AB 1051 and urge your aye vote.
Thank you. Anyone else in support?
Mr. Chair and members, Elizabeth Landsberg with the Western Center on Law and Poverty here in support and appreciate the Assembly members doing this bill. I remember from my days of direct service work how serious many of the dental cases were and how hugely the lack of dental care impacted the overall health. So there's been a lot of attention paid to not enough access for children. As noted in the analysis, only a quarter of adults are getting dental services. This is really a crisis proportion, and we appreciate the Assembly members' actions. We're here in support. Thank you.
Judy Darnell from United Ways of California in strong support. This is a wonderful complement to Assemblymember Wood's bill, and maybe we could start actually addressing this problem if both bills move forward. Thank you.
John Duncan from Western Dental Services, strongly in support.
Katie Andrew from Children Now, strongly in support.
Thank you. Opposition? Questions or comments? There's support on both sides. Any questions and comments? We have a motion from Senator Wynn. Would you like to close?
Thank you, Mr. Chair. Respectfully request an aye vote.
Thank you. Chair's recommending aye. Item number 5, AB 1051, do pass as amended appropriations. Call the members.
Hernandez.
Aye.
Hernandez, aye. Wynn. Wynn, aye. Hall. Mitchell. Aye. Mitchell, aye. Monning. Nielsen. Pan. Roth.
Aye.
Roth, aye. Wolk.
Currently has 4. We'll place that bill on call. We're at item number, thank you, Senator. We're at item number 9, AB 1977 Wood, Opioid Abuse Task Force.
Thank you, Senator Hernandez. And
we have support on both sides.
Thank you. AB 1977 requires health plans and insurers in collaboration with other interested stakeholders to convene an opioid task force, abuse task force. As many of you are aware, abuse of opioid medications has steadily increased in the past decade, and we are now facing a crisis. While the U.S. represents 5% of the world population, we consume 80% of the opioids worldwide. Approximately 6.5 million people in the U.S. abused prescription drugs in 2013, more than double those that abused heroin, cocaine, and hallucinogens combined. While there seems to be an increasing awareness of this epidemic, I believe the approach to addressing it needs to be more coordinated and consistent statewide. I'm aware that some health plans have developed action plans for reducing the number of opioids prescribed and are focusing on other means of managing pain. These efforts appear to be promising in reducing usage. Additionally, other states, in particular Massachusetts, have produced extensive reports and recommendations that have been used by policymakers as the basis for legislation in their respective states. As I became interested in the issue, I reviewed some of these effective strategies and hope to build a preventive-focused legislative proposal based on such interventions, as limiting the initial prescription provided for acute pain, requiring the abuse deterrent formula painkillers for populations at risk for abuse, and by utilizing pharmacists, increasing public education on the appropriate storage and disposal of these addictive drugs. Heard from stakeholders that they felt the strategies I was considering may not have been most appropriate for this state, and they wanted the opportunity to explore other possibilities. I committed to allowing these discussions to take place before determining what preventive strategies to continue to focus on, and which is the task force currently called for in the bill. I'm aware that the Department of Public Health has a work group on the subject, and I'm in conversations with Dr. Smith, the director, about my efforts and interest and working to be complementary to the Department of Public Health. And I respectfully ask for your aye vote.
Thank you. Support?
Hi, Jennifer Simoes with the Medical Board of California. The issue of preventing inappropriate prescribing of opioids is of great importance to the board. This bill furthers the board's mission of consumer protection, and the board respectfully requests your aye vote. Thank you.
Thank you. Anyone else?
Mr. Chair and members, Betsy Armstrong on behalf of the county health executives in support.
Thank you.
Brianna Pittman with the California Dental Association, also in support.
Asha Harris on behalf of the California State Sheriff's Association in support.
Thank you. Opposition? Questions, comments? No questions or comment. We have a motion by Senator Roth. Item 9, AB 1977, do pass to the floor. It's just do pass. Call the members. Would you like to close?
Respectfully ask for your aye vote.
Call the members.
Hernandez.
Aye.
Hernandez, aye. Wynn. Wynn, aye. Hall. Mitchell. Mitchell, aye. Monning. Nielsen. Pan. Roth. Roth, aye. Wolk. 4-0.
Currently has 4. We'll place that bill on call. We're at item number 13, AB 2115, healthcare coverage disclosure. This is also support on both sides.
Thank you, Mr. Chair and members. I'll be brief. AB 2115 requires health plans and insurers to provide information to individuals about free or reduced medical prescription and drug programs via an Office of the Patient Advocate website. This notification of available programs would be in addition to information provided by the plans about potential eligibility for coverage under Covered California or Medi-Cal. The OPA website currently includes links regarding Covered California offerings and Medi-Cal, so information on these potential coverage options will be duplicated and reinforced to individuals. In addition to this information, the website provides additional information on programs that may be of interest and value to people should they experience gaps in maintaining comprehensive coverage. While California has made great strides in expanding coverage, there are still gaps, and people still fear out-of-pocket costs that may occur for medical care and prescription drugs when coverage is lost. I believe calling attention to this website can help educate people so they have a better understanding of what options may exist for them. In working with the committee, I'm amending the bill so there is no longer a specific reference to drug assistance programs, but a broader disclosure reference to low or no-cost medical and prescription drug programs listed on the OPA website. You should have a copy of the mock-up, which the chair has already seen, but I know has been provided to the sergeants. With this amendment, I hope to ease concerns expressed by the health plans that this bill will promote patient use of expensive brand drugs. The bill now focuses entirely on providing individuals with access to more information to help inform their decision-making. I respectfully ask for your aye vote, and I have a witness here in support.
Thank you. Please proceed.
Greg Herner on behalf of the California Life Sciences Association. I think that the author's done a very complete job of discussing the bill. We do have, I just want to make sure that there's one correction made in the amendments that was not in the mock-up, and that is in Section A. We actually have a 2017 date, which should be a 2018 date, in order to allow the notice provisions to work appropriately. So with that, I know it's been a long hearing. Without any, if there's questions, I'm happy to answer them, Mr. Chairman.
It's been a short hearing. Long. Yesterday was a long hearing.
Yesterday was long. Yes, it was.
Okay. Anyone else in support? Opposition?
Stephanie Watkins on behalf of the Association of California Life and Health Insurance Companies. We had an opposition position on the previous version of the bill. Based on these most recent amendments and the technical fix on the date, I think we'll be reviewing those and likely removing our opposition as the bill moves forward. Thank you.
Anyone else?
Mr. Chair and members, Teresa Stark on behalf of Kaiser Permanente would also like to thank you and your staff and Dr. Wood and his staff for their work on the bill. We did have pretty significant concerns with the previous version of the bill. We'll review this language, but we really appreciate the work. It's moving in the right direction. Thank you.
Thank you. Anyone else?
Allison Ramey with Blue Shield of California would like to thank the author for the latest round of amendments, and the technical change should be able to put us to a neutral position. Thank you.
Thank you. Questions, comments? Seeing no questions or comments? Motion, Senator Roth, would you like to close?
Respectfully ask for your aye vote.
Thank you. Item number 13, AB 2115, do pass as amended. Call the members.
Appropriations.
Two appropriations, I'm sorry.
Hernandez. Nguyen I. Hall. Mitchell I. Monning. Nielsen. Pan. Roth.
Aye.
Roth I. Wolk.
That's three. We'll place that bill in call.
Thank you very much. Appreciate it.
We're at item number 11, AB 2007, McCarty. Good afternoon.
Good afternoon. Thank you, Mr. Chair and members. I'm pleased to present AB 2007, which helps protect kids and youth sports from injury by requiring the similar protocols we have in place for high school athletes to be in place for youth athletic programs. Specifically, these protocols, as we may know, focus on the immediate removal from the game if an athlete is suspected of sustaining a concussion and receiving written clearance from a licensed healthcare provider to return to athletic activity. We know that providing this information to coaches, parents, and athletes is crucial in ensuring that kids are informed and parents are engaged to make the best decisions for their little athlete. With me today are Mike Chizar with the California Athletic Trainers Association, sponsor of the bill, and a former NFL player, George Visker, who's now working as a traumatic brain injury consultant. Thank you for your consideration. Respectfully ask for your aye vote.
Thank you. Anyone in support?
Chairman Hernandez, committee members, and staff. My name is Mike Chissar. I'm representing the California Athletic Trainers Association. It's an honor to be before you today. I'm speaking on behalf of AB 2007 with George Visker, former NFL player and noted baseball star, Assemblymember McCarty.
Oh, yeah.
Athletic trainers, as many of you know, are experts in the management of concussions, both from a research and treatment perspective, and we regularly work with athletes and others to treat and prevent this injury as a frontline practitioner in a multidisciplinary team. The CATA actually sponsored the first concussion bill about 8 years ago. So obviously it's an important issue for us individually as healthcare professionals as we deal with these athletes on a regular basis and for the profession. We think this is a very important bill that closes a loophole that leaves many of California's vulnerable young athletes unprotected from this injury. We've worked with a number of stakeholders and amended the bill to reflect their concerns. And while California would not be the first state to enact a bill that allows these protections to be passed down to youth athletes, not just high school athletes, it would place California in the forefront of this movement. I'm here to answer any questions you have and respectfully ask for your aye vote.
Thank you. Anyone else in support?
Hi, my name is George Visker. I played with the 49ers in 1981 during the Super Bowl season. I developed hydrocephalus, water on the brain from concussions, and at the age of 22, underwent 3 emergency VP shunt brain surgeries in 8 months. I was given last rites. I'm on my 9th brain surgery now. I've had 36 years of grand mal seizures, major short-term memory issues. I went on to complete a biology degree, Worked as a wildlife biologist, had an environmental consulting firm for years. Due to cognitive impairment and short-term memory issues, I lost the business, lost the home, was forced to go out on Social Security disability 2 years ago because I literally cannot remember where I parked my truck right now at this moment. And I'm reading through this bill, and I completely back all of these issues. Had we had, Coach, my worst concussion ever, my third year Pop Warner. I was 13 years old playing for the West Stockton Bear Cubs. I was knocked unconscious in a worthless bull in a ring drill and hospitalized. Studies have shown the earlier you're concussed, the more predisposed you are, the lower your threshold for the next concussions. I had a number of concussions through my career. Like I said, ultimately, developed hydrocephalus at the age of 23. And so not even taking into consideration the financial gains from doing this, the price, the carnage that the families pay, what this does to everyone, I call it the ripple effect. My injury has impacted everyone around me. I have short-term memory issues. I have anger management issues. I have poor judgment. Again, what it has done to the people that I love the most, it's hard to even explain unless people have been there. And so again, I totally support this. I offer, and I don't know how much time I have left because I'll go on and on, but I've lived this for 36 years. And I can tell you right now that the cost to this, no matter what it is, if there is even a cost, would be well worth it if we can keep one family from going through what my family has gone through. So I appreciate your time to be able to speak on this. Thank you.
Thank you. Anyone else support? Name and position.
Mr. Chairman, members, Kathy Barankin with the California Coalition for Children's Safety and Health in strong support.
Kitty Bourne representing California school nurses as well as the American Academy of Pediatrics. We are in strong support.
Mr. Chairman and members, Carl London on behalf of the California Physical Therapy Association, also in support. Thank you.
Thank you.
Mr. Chair and members, Stuart Thomas on behalf of the California Medical Association, strong support. Thank you.
Thank you. Opposition? Questions, comments? We have a motion. Oh, question, Senator Nguyen.
Thank you, Mr. Chairman. Assemblyman, the intent of the bill, I understand and I appreciate. One of the things that I wanted just to make sure I understand and for clarification, you have on here, it says the bill would apply these provisions to athletes participating in youth sports organization as defined to include organization, business, nonprofit entities, local government that sponsor or conduct sports competition, training, camps, and et cetera, okay, that are individuals of 17 years of age or younger. Then on page 5, then it says irrespective of their ages. So I just want to make sure that we don't in any way hurt any youth group who might not have the insurance that qualifies because they're all run by parents, or maybe if, let's say if I decide lots of kids in our neighborhood, maybe we do a little competition between the youth groups in the neighborhood. We form something very informal just for that 1, 2, or 3 games. Would this bill go into effect in very informal setting like that? Or second, would it also affect youth leagues that also by default have adult leagues as well that are over 17? How does that come into play? Would this bill go into effect for that? Because I'm looking at the liability, and I don't want any youth group to go out completely. My boys are on AYSO and T-ball as well, which, I mean, they're under 5. So I just want to make sure that the parents aren't penalized for trying to volunteer like myself or my husband.
Sure. Of course, we had a lengthy debate in the other house on this, and we don't want to eliminate youth sports, as was mentioned earlier. We have an obesity epidemic. We need kids being more healthy, not less, but we also realize that part of health is this brain injury epidemic that's happening as well. And so we tried to craft this focusing on the recreational youth sports programs that don't have a lot of resources, that don't have professional staff. And so I don't think that we are going too far, as you have addressed some concerns, but want to let our athletic trainers, a sponsor of the bill, opine a bit more.
So very briefly, there is no real cost. Most of the educational components that are included in the bill, you can access online for free. In talking to some of the sports leagues and how this bill would affect them, they felt they had decreased liability because now they knew what they needed to do for their coaches, or what they needed their coaches to do. So we've tried to craft the bill so that the leagues had flexibility on how they provided education, and again, make it so there was no cost to them. So there's no mandate on cost. In terms of the age breakdown, obviously 17 and under, you're still under your parents, but there are leagues like some AYSO soccer leagues that have under 19 teams, under 20 teams, right? Or they might have kids on the same team, some that are 17, some that are 18. So that was why that language is included. It was working with the assembly consultants and the committee staff on that. So an adult recreational league would not be included because there's no youth component to that. And I don't think the way it's crafted, I mean, it is a formal league, not an informal gathering of athletes or teams that would trigger folks being responsible for the statute.
Thank you.
Thank you. And if you may, Chair, I think I didn't answer that issue, but it's not intended to focus on pickup games and so forth. And I think as the definition reads, this is related to youth sports organizations and businesses, nonprofits, local governments that conduct competitions. And so I don't think that the pickup play would be relevant to what we're looking for.
We're pretty competitive.
You keep score? You have standings online, rankings, playoffs?
Okay, I'm going to stop there. I'll plead my fifth now.
Okay, so, seeing no other questions, somebody moved it? Senator Roth. We have item number 11, AB 2007, due pass. Chair's recommending aye. Call the members.
Hernandez.
Aye.
Hernandez, aye. Wynn. Wynn, aye. Hall. Hall, aye. Mitchell. Mitchell, aye. Monning. Monning, aye. Nielsen. Pan. Roth. Roth, aye. Wolk. 6.
That's 6. It's enough to get out. We're going to place that bill on call. We've got some absent members.
Thank you, Mr. Chair.
I believe we've got 2 members left. Sergeant, if you can call those remaining members. Otherwise, let's start lifting some calls.
Is that consistent?
Yeah, let's, we can do the consent calendar, item number 3, number 4, number 12, and number 14. Is there a motion? Moved by Senator Hall. Call the members.
Hernandez.
Aye.
Hernandez, aye. Wynn. Wynn, aye. Hall. Hall, aye. Mitchell. Mitchell, aye. Monning. Monning, aye. Nielsen. Pan. Roth. Roth, aye. Wolk.
6. At 6, we have a member absent. We're going to place that bill on call. We have 2 members absent. Let's go ahead and lift the calls. We'll start with item number 1, AB 72. Call the absent members.
Wynn.
Did you take the names on that, on item 1?
Yeah.
Yes, they were due pass as amended. As amended.
Wynn. Wynn, no. Hall. Hall, aye. Mitchell. Mitchell, aye. Monning. Monning, aye. Wolk.
Does everybody vote at one? Did everybody vote?
Wolk's not here.
Okay, that current vote count is 7-1. Everyone that is here voted for that. That bill is out. Item number 5, AB 1051, Manshine. Call the absent members.
Hall. Hall, aye. Monning. Monning, aye. Nielsen. Pan. Wolk. 6.
Current vote count is 6. We have an absent member. 2 absent members. We'll place that bill on call. Item number 6, AB 1300, Ridley Thomas. Call the absent members.
Wynn. Wynn, aye. Hall.
Item number 6. Item number 6, call the absent members.
Hall. Hall, aye. Monning. Wolk. 7, 0.
Currently has 7. There's any absent members?
He's not voting. So no, it's not. No.
So everyone that's here that's voting at 7-0, that bill is out. Item number 7, AB 1726, Bonta, call the absent members.
Hall. Hall. Hall, aye. Mitchell. Mitchell, aye. Monning. Monning, aye. Roth. Wolk.
Everyone's vote is here. Current vote count is 7-0. That bill is out. Item number 8, AB 1739, Waldron. Call the absent members.
Hall. Hall, aye. Mitchell. Mitchell, aye. Monning. Nielsen. Monning.
I'm sorry, the chair's position on this?
Aye.
Aye. Monning, aye.
Monning, aye. Nielsen.
Aye.
Nielsen, aye. Pan.
Aye.
Pan, aye. Wolk.
Current vote count is 8-0. That bill is out. Item number 9, AB 1977, Wood. Call the absent members.
Hall. Aye. Hall, aye. Monning.
Aye.
Monning, aye. Nielsen. Aye. Nielsen, aye. Pan.
Aye.
Pan, aye. Wolk.
Current vote count is 8-0. That bill is out. Item number 10, we need a motion, and item number 10, AB 2004. Moved by Senator Pan, do pass 2 appropriations. Call the members.
Hernandez. Nguyen. Nguyen, aye. Hall. Hall, aye. Mitchell. Mitchell, aye. Monning. Nielsen. Nielsen, aye. Pan. Pan, aye. Roth. Wolk.
Everybody voted? Okay. That vote count is 5-0. Everyone that's here voted. That bill is out. Item number 11, AB 2007, McCarty. Call the absent members.
Nielsen. Nielsen, aye. Pan.
Aye.
Pan, aye. Wolk.
Current vote count is 8-0. That bill is out. Item number 13, AB 2115, Wood. Call the absent members.
Hernandez.
Aye.
Hernandez, aye. Hall. Hall, aye. Monning. Nielsen. Nielsen, aye. Pan. Pan, aye. Wolk.
Current vote count is 7-0. That bill is out. Okay, I believe Gibson, I saw? No. Which one?
19. We did 19, Bonta.
Oh, 19, sorry. Item number 19, AB 2737, Bonta. Call the absent members.
Hernandez. Hall. Hall, aye. Mitchell. Mitchell, aye. Monning. Monning, aye. Pan.
Aye.
Pan, aye. Wolk.
Current vote count is 7-0. That bill is out. Actually, we go by file order, so Assemblymember Nazarian's first.
Thank you, Mr. Chair, and I'll be brief. Instead of going through about 5-minute testimony, your committee was very generous in supporting my bill last year. Unfortunately, the governor—
You're going to be brief?
I asked for an aye vote.
Oh, so you're going to be brief?
That was it.
It's unusual for you to be brief.
Well, sometimes when I'm asking questions, that might
I'm just making a comment. You're being brief.
Now I'm making a brief presentation.
Thank you.
Thank you.
We have support. Is there support?
And Mr. Chair, I'll be brief. Rand Martin on behalf of the AIDS Healthcare Foundation, the sponsor of the bill, and we urge your support. Thank you.
Thank you. Is there opposition? Questions, comments? We have a motion.
By Hall.
By Hall. Item number, would you like to close?
I asked for I vote.
Thank you. Item number 17, a due pass as amended to appropriations. Call the members.
Hernandez.
Aye.
Hernandez, aye. Wynn. Wynn, aye. Hall. Hall, aye. Mitchell. Mitchell, aye. Monning. Monning, aye. Nielsen. Pan. Pan, aye. Roth. Roth, aye. Wolk. 7-0.
7-0, that bill is out.
Thank you.
Thank you. Now, I believe Gomez is not here, is he? Okay, Gibson. Item number 182640. Please proceed.